If you keep getting knee pain, and every time you try to fix it you go straight to the knee, that may be exactly why it keeps coming back. Because very often the knee is not the true problem. It is the place that starts complaining when the whole mechanism is badly organized. So if the weight is going through the body in the wrong way, if the fascia is not giving support, if the legs are twisting and the joints are losing their line of mechanical advantage, the knee is the place that ends up paying for all of it. That is why we cannot look only at the knee. We have to look at the mechanism. We have to move from a sloppy body organization to a position of mechanical advantage. And in this video I will show you exactly how. First, the 3 main problems that keep creating the knee pain. Then 3 things you can start changing in daily life immediately. And at the end, I will teach you a bonus exercise so you can begin to use this new coordination directly with your own body. Let's start with the problem number 1. Improper weight distribution. The first big problem is that the most people are loading the wrong part of the knee. They carry too much weight on the front of the joint, but that is not where the knee is best built to receive compression. The reinforced part of the knee joint is more at the back, where the bony structure has a larger surface. That is where the bones are better designed to take load. So when the femur moves forward relative to the tibia, the body takes weight off that reinforced back section and dumps more strain into the front. That is where trouble starts. So the issue is not only that there is pressure on the knee, the issue is where the pressure is going. And once you see this, you start spotting it everywhere. Look at someone walking with the belly in front of the pelvic bone and also in front of the head. The whole mechanism has already fallen forward. And when the mechanism falls forward, the knee gets trapped in the deal. Problem number 2. Slackening of the IT band. The second problem is the loss of the tensile support. Achieving poise depends on the tensile strength of the fascia, especially the iliotibial band. But when the pelvis rotates forward and down at the front, in an anterior pelvic tilt, the IT band becomes slack and limp. And the moment that happens, the body loses one of its key tension cables. Now the body cannot rely on structure the way it should. It starts overusing muscles just to stay upright. It starts hanging, collapsing, compensating. And the knee loses support. So this is not just about strength. This is about whether the body still has the fascial support system that allows it to organize itself efficiently. And again, you can spot this very easily. You see people standing with almost the whole weight on the one foot, or resting like a paws on the outside of the foot. Why? Because they are trying to stretch the IT band without using the pelvis to stretch the fascia the way it should happen. So the way of organizing the anchor correctly, they hang off the side and distort the whole line of support even more. Problem number 3. Weight on the outside of the feet. The third problem is living on the outside of the feet. A lot of people stand and walk like this all day, and it twists the legs. And once the legs twist, the knee is no longer receiving weight through its stronger line. Because the inner condyle of the knee is larger than the outer one, weight should ideally be carried more on the inside of the knee and the inside of the foot for better stability. But many people do the exact opposite. A clear sign that the weight is shifting to the outside of the feet is that, when viewed from above, the outer edge looks curved rather than straight. Another clear sign is that the person will walk with duck feet. They roll onto the little toes. And now the load is going into smaller bones that are not made for carrying it that way. Even the Greeks already understood this. Just look at how they sculpted the foot. They already knew where the weight was meant to go. So when the feet turn out, the weight spills onto the outside edge, the whole leg loses its better support line, and once again the knee is the one that takes the hit. What doesn't work? Now this is where many people lose years. They stretch, they strengthen, they do more knee exercises, and still the problem keeps coming back. Why? Because traditional strengthening or stretching often happens inside the same habitual coordination that created the pain in the first place. So if the body is shortened, bent and poorly organized, and then you build more muscle on top of that, you are not fixing the problem. You are teaching the bad pattern to become even stronger. You are cementing faulty coordination deeper into the nervous system. That is why the first step is not just doing more. The first step is seeing the habit, understanding the faulty mechanism, and applying new concerted orders of movement so natural coordination can begin. Now, let's come to the solutions. Solution number 1. Reorganize the torso, because the torso changed the knee. This is one of the most important ideas we have to keep in mind. The muscles and fascia that determine the position and stability of the knee in space are primarily located in the torso. So if the torso is crumbled or misaligned, it changes how weight travels through the legs and places pressure on the knees that the joints are not designed to handle. So the first solution is simple but powerful. Stop thinking locally and start thinking globally. If you reorganize the torso, you change the pressure on the knee. And here is one detail that matters a lot. When the lower ribs come back in relation to the ankle spot, the weight settles more onto the heels and into the back of the knee. And that is exactly where the bones are better designed to receive compression. That is one of the clearest signs that coordination is starting to work. The body is no longer falling forward and dumping force into the wrong place. Solution number 2. Get the anchor at the pelvis going. Now we go to the pelvis anchor. To get the IT band taut again, you need 3 movements happening together in the pelvic area. Get the sitting bones forward, bring the inner thigh back, bring the outer thigh forward. These 3 antagonistic pulls draw the IT band fascia taut, and when the tension is starting, the whole support mechanism changes. Now the body does not have to hold itself together with so much muscular strain. Now it can begin to use passive support. That is a huge shift, because once fascia starts doing its job, the knee stops being left alone with forces it should never have been carried by itself. And an important point here, your knees should be hip width apart, and your heels should also be hip width apart. That spacing matters, because if the spacing is wrong, the leg will keep twisting and you will miss the effect. Solution number 3. Fix the feet positioning. Now bring it all the way down to the feet. Position the feet so that the outer parts of the feet are parallel to each other. This helps stretch the IT band, but it's not just a foot trick. It's the result of the internal rotation of the whole leg, and when it starts happening, something important changes immediately. The weight of the torso begins to come back, and as the torso comes back, the load shifts onto the backside of the knees, where the structure is better designed to carry it. At the same time, the IT band stretches even more through the tensegrity system, loading at the back and lifting at the front. So this one change is doing much more than changing the look at the feet. It's reorganizing the support mechanism of the whole body from the ground up. When you put these 3 solutions together, the whole story changes. You stop throwing weight onto the front of the knee. You stop hanging on a slack IT band. You stop twisting the legs by living on the outside of the feet. And instead, you begin building a mechanism that can finally support the knee properly. Now let me teach you how to bend in the new way. This is the bonus exercise for the advanced ones. Most people bend by sending the knees forward over the feet. That is the old coordination. That is the sloppy mechanism. But here you bend at the hip and the knee joints only, while inhibiting the ankle joint. In other words, you refuse to bend at the ankle. And that changes everything, because now the hips move back in space, and that shifts the weight away from the front of the knee and back toward the reinforced back portion of the knee. Now the pressure is finally going into the stronger place. At the same time, direct the iliac crest back and up while keeping the upper sternum forward and up. This stretches the T-band and the thoracolumbar fascia, giving the body free energy for stability without muscular strain. So this is not just an exercise, it's a direct way of teaching the body mechanical advantage. And that is the real message here. The pain may show up in the knee, but the cause usually starts in the way the whole body organizes the weight, tension and support. Change the mechanism and you change the reason the pain keeps coming back. If you are done living from one painful joint to the next, and you want to start preventing these problems at the level of the whole mechanism, write me at info@postureispower.com I offer one-on-one Zoom lessons, and you can find out more on postureispower.com.